When I entered medical school, I did not know what I wanted to become. But I was lucky enough in the year 5 of medical school to meet a few very good respiratory physicians. They were in charge of my clinical group. So under their supervision, I think we got a lot of exposure to very interesting cases. So that sparked my interest in internal medicine in general. Then during the training itself, I realized that I'm very interested in respiratory medicine and intensive care medicine. So that is why after my basic training, I went to become specialty trainee in respiratory medicine and intensive care medicine. But along this way, I think I've been very inspired by not just my seniors, but also by my fellow colleagues, my patients themselves, okay, because you can always learn a lot from your patients, and colleagues who are not in medicine themselves. For example, I went overseas for my overseas severe asthma training, and it was during that 1-year training when I met scientists. And I think it's the scientists who sparked my interest in understanding the mechanisms behind severe asthma and the mechanisms behind each patient's disease condition. So I used the knowledge that I gained from that 1 year to then bring it back to my practice as a clinician. So I think the research training does help you become a better clinician. The mission of the respiratory practice is to provide medical advice and services based on the current best practices. But more importantly, is to provide personalized treatment based on individual patients' physical and mental needs. We see a variety of patients ranging from mild to very severe. Typically see patients with chronic coughs that can be related to asthma, chronic obstructive lung disease, bronchiectasis, lung fibrosis, etc., etc. We also do allergy testing for patients with allergies driving recurrent respiratory exacerbations. We also see patients who are heavy smokers, so we offer lung cancer screening by risk profiling them and performing CT lung screening as required. We support our fellow respiratory colleagues, for example, the oncologists, should their patients develop cancer or cancer treatment-related complications such as lung inflammation, pneumonitis related to their cancer treatment. Okay, so all patients of different age, they basically will have similar needs. They want to know what is the diagnosis. They want to know how they can be treated and how fast they can recover, whether it's an acute problem or a chronic issue. So essentially, I think all patients want good medical care and kindness from their healthcare provider. First and foremost, we provide lung function testing to check for airway diseases such as asthma, chronic obstructive lung disease. We look at lung parenchyma issues such as lung fibrosis, pneumonitis, so that's lung function. We also do allergy testing for things in the environment and also food allergy, so aero allergens and food allergy. We provide smoking cessation counseling for people who want to quit smoking. We provide lung cancer screening services as part of the smoking cessation package. For patients with chronic medical issues or chronic airway issues resulting in breathlessness and drop in their stamina, we offer physiotherapy addressing sarcopenia and their heart-lung stamina. Okay, I think we also cannot forget the importance of the role our clinic assistant play, because they are the ones who will reinforce how to use an inhaler properly and how to take care of the spacer. Because it's easy for the doctor to prescribe a medication, but if we do not ensure that the medicine, the inhaler is used properly, then the medicine is not going to work. So I think I also have to highlight the fact that the clinic assistants do play a very important role in teaching our patients how to use their inhalers properly. Okay, so I think what they can expect from their first consultation is that after they register, me as the doctor, I will request for all of the investigations that have been done before, especially any previous radiology reports, and better still, the images for me to review by myself. I will require medication history, past medical history, and any blood test results that's available. So I will review usually what has been done already, and then ask the patient to then proceed with a lung function test to see at this point in time during the consultation what is the current lung function status, and then followed by a detailed consultation with physical evaluation. Quite a few of my patients are actually self-referred, so you do not need to necessarily come with a referral letter. If you have all the information, for example, previous scans, scopes, blood tests, and you can give me a good story of what has happened so far. But of course, a referral letter will be useful. Most patients, if they can provide the information that I require, I do not need a referral letter. Respiratory conditions such as asthma are actually chronic airway conditions that can be well controlled with a simple steroid inhaler. However, there are a lot of misconceptions around steroid inhalers. The first misconception is that people are worried that they will become dependent on the steroid inhaler. The second misconception is that they worry about the side effects of steroid inhaler, maybe affecting their bone health, or stunting the child's growth, or increasing the risk of osteoporosis, cataract, etc. So I was saying these are misconceptions because asthma is a chronic condition that requires a steroid inhaler to control the inflammation. And steroid inhalers are not addictive. They are there to control. You will not develop a dependence. Paradoxically, when you use a steroid inhaler to control the underlying, say, asthma, you end up using less and less medicine because your body will become less and less reactive. So I would say that to address this misconception, patients will become better controlled using less medication and they will have less steroid side effects. The values that guide my approach to patient care is the first thing, it has to be personalized according to, firstly, the underlying biological mechanisms that's driving, say, their chronic cough. Because it can be due to so many things. It can be due to their allergies, it can be due to the lifestyle, it can be due to the external environment. So that's what I mean by personalized care. However, we also have to appeal to the psychosocial aspects of the care in order to ensure that they continue the treatment that you advise at home. So I think it's important to adopt a personalized approach based on their biology and also based on their mental psyche. Patients can Google, look for us at O2 Healthcare Group. You can either contact my clinic via the landline listed or WhatsApp our clinic directly. My two clinics are located at Mount Elizabeth Novena Specialist Centre. The nearest MRT is Novena. And also my second clinic is located at Farrer Park Medical Centre. The nearest MRT is Farrer Park.